The numbers, they tell the story. This is a look at Maryland's COVID-19 data dashboard as of this taping on Friday, and it depicts the surge in cases that is again pushing hospitals to heighten their alert level. Meanwhile, crowded hospitals are matched by crowds hoping to stay out of the ER as testing demands push their limits. Hello everyone, I'm Jason Newton. Welcome to 11 TV Hill. By now, you or someone you know may have been affected by the latest COVID variant. The rapid spread of the highly transmissible Omicron variant is apparent. From flight delays, canceled gatherings to hospitalizations, this is reminiscent of what we've already been through with COVID-19. Now, a tour of Central Maryland shows just how much of a concern this all has become, starting in Carroll County, where Carroll Hospital has reached emergency levels. Early last week, bed capacity topped 50%, largely due to COVID patients. It even caused them to occasionally send ambulances to other nearby hospitals to accommodate the surge. In Anne Arundel County, a mask mandate reinstated and a return to outdoor dining in Annapolis. A new round of permits will be granted to restaurant owners. Here in the city, a new approach for a few venues. The Charles Theater and Gunther and Company restaurant requiring proof of vaccination, a trend that has been seen at establishments in New York City as well. Then on to Howard County. The masks are back on there. County executive implemented the latest indoor mask mandate last Sunday. And in Baltimore County, Towson basketball dropped concessions and went to 50% capacity at CQ Arena. Now, the most noticeable change in Baltimore County, the return of mandatory masking there. This is the fourth day of the new restrictions that are in effect. A face mask is once again required in all indoor public spaces, and this applies to anyone 5 years old and older. Dr. Gregory Branch is joining us from Baltimore County. Thanks for the time, sir. I just want to get an update as far as the county goes, because you guys came out pretty early bringing back the mask mandate. Tell me a little bit about that and what concerned you.
Okay, well, thank you for having me here. I'm glad to be able to talk with you and your listeners. COVID-19 is still here, unfortunately. At this particular time, we know the numbers are going up, and they're going up, and they're going up. But the one thing we've always said, that if the transmission goes up enough that we start to impact our healthcare facilities, then Houston, we have a problem. And we recognize that the hospitalizations are going up tremendously. And a lot of our healthcare staff are being affected by COVID at this particular time. And so because of all of those things and the high transmission rate of this, we've got to say at this point now, let's halt, take a step back. We've got to put those masks back on.
You mentioned healthcare facilities and hospitals. How much of a concern is that for you when you see those numbers spike the way they do and some of these staffs getting stretched once again like it was early on?
Right. Very, very concerning, because obviously you could have all the beds in the world that you, available, but if you don't have the staff to man those beds or women those beds, then you're going to have a problem. In addition to that, I think we have to understand about the healthcare system. When it comes to testing, a lot of folks want testing, right? Our healthcare system cannot test all those people. Our healthcare system is stretched. Our healthcare system is in crisis at this particular time. And those are some of the indicators that tells you that we now have to go back to the basics.
I'm curious of what your thoughts are when you see some of these lines of people. I just crossed one downtown Baltimore wrapping around the block. I mean, as a healthcare professional with so many people out, I guess it's double-edged. I guess you're pleased that people are heeding the advice to go get tested, but the reason for them getting tested, it might bother you a little bit that some may have been exposed.
I have a slightly different philosophical thought about that.
Sure.
Unfortunately, people are online, they have to get tested. But I will say to you that it disheartens me that the lines for testing is so long, yet the lines for vaccination is not. And to me, I think at this point now, I've got to stress to you and all your viewers that they must get vaccinated. That's the way we're going to be able to get through this pandemic. We can vaccinate our way out of this.
While we'll stick on tests for just a second, because I'm curious, is there anything that any county can do differently as far as getting people through these lines? Or is this just a matter of having so much demand and just not enough supply to meet that?
And you just said this, the latter is true. You just hit the nail on the head. And that tells you that our healthcare system is overwhelmed.
Hmm.
Usually, when people need to go to get tests, what do? They go to their primary care doctor,
Yeah.
right?
Mhm.
So now they're not able to do that because the whole system is overwhelmed. And that's why we're in crisis the way we're in crisis at this particular time.
Early in the show, we showed some of the numbers for the state in general, and it really shocked me to see, 10 to 11,000 new cases. And I'm curious for you as a health professional to see that number. Was it due to you to see that many new cases now? And does it change your mind that it's Omicron, which some people are saying milder and not maybe as rigorous as the original?
Okay, so I think that we have to understand what that actually means.
Okay.
First and foremost, we have to understand that the transmission of Omicron is much, much more,
Mm-hmm.
right? Now, the virulence of it might be a little less. However, if you're infecting a lot more people, then potentially you're going to affect a lot of people when it comes to being very deadly or putting them into the hospital. So even though the virulence for Omicron might be less than that of Delta, because of the astronomical numbers, you're still getting a lot of hospitalizations and potential deaths secondary to Omicron. So COVID is alive, it is here,
Mm-hmm.
and it is deadly. And we must be able to, everybody to understand that they have to get vaccinated.
Two more things. I'll be quick with both of them. One is for all the people in the county, and just paint the picture for them, because there's some who may say, listen, I got both shots, I got a booster, I feel like I'm good, and you're bringing back this mask mandate. Why should I do it?
You know what? There are people who are sick. Our healthcare system is overwhelmed. There are people who are dying. And guess what? Masks really don't cost as much. I didn't shut down the restaurant. We didn't shut down the businesses.
Mm-hmm.
We're basically saying, just wear the mask, because we know that mitigating mask wearing does work. So do it for yourself, do it for your family, do it for your community. It's just wearing a mask.
And the last one, the word of advice for people who are out searching for those tests right now, is it just patience is the word right now for them?
I would just say that, and I would ask everyone, if you're symptomatic or if you've really been exposed to somebody who has a positive case, you're going to need to go get a test and just kind of have patience and get that test. However, if you just want to get a test because you're curious, I'm trying to travel, I'm trying to do all the, and it's not having anything to do with your medical concerns, I would say, please hold off and let somebody else who's potentially sick with other risk factors to be able to get that test just for now.
Mm-hmm.
And hopefully within the next few weeks, we'll be able to catch up and get more testing out there.
Will you do some of that surge testing sites where you put some special sites with more? Or are you still kind of mapping out the plan?
We are mapping out the plan, but we know that as we move into the new year, that we're going to have more sites up so that people can get tested.
All right, that's Dr. Gregory Branch. Thank you for the time, sir. It's always good to see you.
Thank you. God bless.